Good afternoon.
Hello, good afternoon.
I have a great pleasure to talk to Dr. Cuadrado.
Thank you so much. The pleasure is mine. Thank you.
We are after your workshop. What we can say Monday morning to our patient about the digital world, about digital dentistry, about the digital workflow you showed tonight?
It is difficult to answer that question, you know. I think that the most important question is not to wait the patient to ask us about digital dentistry. It's just we need to incorporate in our practice as soon as possible because we cannot miss this train, you know. I think it's a train of future, of new treatments, of new possibilities that comes to help us, both the whole team, dentist, surgeon, prosthodontics, and also lab technicians. So I think we have not to wait to offer to our patient, but to be sure the digital technology is coming here to make our treatments better. Mm-hmm. Without doubt.
What we can gain today for our patient using the digital workflow you showed?
I can tell you that in our clinic we are doing things better. We are doing new things, new treatments, and we are providing our patients with more quality in our treatments in a very particular way, which is the use in all the application of the digital technology, from ortho to prosthetics to implants to guided surgery. So the extreme accuracy of the Trios intraoral scanner allow us, and all the software packages allow us to give our patients better treatments, from my point of view. So we are really happy to the possibility of the organizers of this Bego Congress in Warsaw, in Poland, the opportunity to share our knowledge with this amazing group of colleagues, and I'm very happy and very proud to be here. Thank you for that.
Mm-hmm. And how about the traditional impressions at your clinic? Does it really not exist anymore?
We cannot talk in absolute values about digital, you know. Of course, sometimes you are using regular impression taking. Even you are delivering conventional and handmade, handcraft to the maximum amount of aesthetics prosthesis. From my point of view, we have to use the best of both worlds. The only thing is that regarding digital, we cannot apply the conventional protocols from the conventional dentistry to digital because we need to slightly change the protocols. But for me, the mixture of digital technology and digital resolution of our cases and finish with the excellent handmade, handcraft prosthesis, it's amazing with excellent lab technicians. So I think you get the best value and so the best revenue for our patients.
Mm-hmm. How important is cooperation with the whole dental team? I mean the dental assistant and the dental laboratory dental technician.
It's basic, you know. It's the team approach. It's more than ever necessary in this field, you know. But it opens new kind of collaboration. For example, I can scan a patient in Madrid, in Warsaw, and I can have a lab technician, let's say, in New York or Hong Kong, and with the internet connection, he can design in my clinic in Madrid from Hong Kong with a TeamViewer connection or you know, and at the same time, he's designing in Hong Kong, in New York, in Auckland, wherever you want, in Warsaw, but the work is being produced in Madrid or in, you know what I mean. So it's amazing the amount of possibilities that give us this new technology. Not new, because the most important thing is that for the first time, one scanner, an intraoral scanner, is working and is capable to substitute the conventional impression taking with silicone supported or with regarding implants and also natural tooth.
Mm-hmm. Could you tell us something about the Implant Studio software system? How useful it is?
Implant Studio is the one for me I think is the first guided surgery software designed to be a guided prosthetics software, because the most important thing is not to, of course it is important to guide our implants, but the most important thing is to screw our previously made provisional prosthesis, a previously milled or print provisional prosthesis that can be screwed without no indirect adjustment in our patients. So I always like to talk regarding Implant Studio, or the first guided surgery software that starts a new kind of treatment, which is guided prosthesis. For me, that's what our patient wants, the guided prosthesis to be placed at the end of the intervention. And Implant Studio allow us to do that thing, because all the flow is designed for that kind of success, to place the prosthesis at the end, from a single crown to a full arch.
Mm-hmm. And could you explain the difference between milling and printing?
Different technologies. Printing is to like build, like you have printers available in the from low budget to high end. We are adding material to build, for example, a crown, or to build a guide, or to build a model. We are adding. With the milling machines, we are from a disc or for a block, we are removing material to create the crown, or the guide, or the bridge, or the full arch. Different technologies to arrive to the same point, to have a guide or to have a bridge.
And are there? Do we have any cases that only we can mill or only we can print?
Nowadays, it depends on the material you are going. If we are talking about provisional, about resins, you can choose with milled or with print. But you are going to use materials like chrome, cobalt, metals, zirconia, ceramics. Today, you are not able to. Today, you are not able to print. I know there are a lot of developments trying to reach that situation, and all the future is really improving our materials. All the companies in the prosthetics world are designing new materials to make things easier for the lab technicians and for the clinics. Mm-hmm. In terms of getting the excellent results with keeping the things simple.
Mm-hmm. How important is provisorium when we make some big cases or some single crowns?
That's a very important question. In our protocol in I2 Implantología, our clinic in Madrid, regarding digital, my advice would be to think different. We need to make things different, as I told you before, regarding the protocols and everything. So when we are facing a case from a single crown to a big case, full arch, fully digital, we are always trying to finish our case with a nice provisional in terms of aesthetics, function, occlusion, everything. Once we have the provisional finish from all the points, aesthetics, occlusion, function, and also passive fit, we are making the final prosthesis. And that's very easy. With these new technologies, you can switch provisionals to make things better in terms of aesthetics, occlusion, even to manage the gingiva, the gum, So for me, it's basic. It's the utmost importance to have a nice, a final, let's say, a final provisory.
Mm-hmm. We know that the important thing is occlusion, especially on prostheses or bridges based on implant. How do you think we can have a stable occlusion during the years after we finish the treatment?
Okay. Again, we need to mix things from the digital and from the conventional. We need to mount an articulator to make everything in the same way we are doing in the conventional dentistry, coming and mixing with the digital approach. So it is not difficult, but my advice would be to get all those final results, let's say, from the occlusal point of view and function and aesthetics with the provisory. Because you need to produce your final prosthesis being, let's say, a duplicate of that prosthesis. and you will not get any problem. You know, this is not exact, but most of that's the best approach most of the times.
And when we talk nowadays about the materials in dentistry, we can say that we see that we're getting back into composite, into resins. Nowadays we have also full zirconia. So what do you think is gonna be the future of the materials? Or what is the gold standard?
I understand. I don't know what is now the gold standard. It depends of every doctor and every lab technician, no? But I'm sure that most of the companies in the materials business, they are designing new materials with new possibilities, as I told you before, to keep the things simple in terms of speed, of resolution of the treatments, to use not a lot of devices to be milled or to be produced or everything. And I think that in the forthcoming years we are going to face a revolution in not only in prosthetics but in the whole dentistry. For me, digital implantology, coming from an intraoral scanner, from those kind of devices, are changing the dentistry, but also are changing the roles of each of the persons involved in the treatment, from the dental lab technicians to the clinics. For me, it's changing slightly all the relationship, and it's our mission, our goal, to all those relationships, to take care of that, to get the best for all the different professionals involved in the treatment. So I think that the young doctors coming out of the university are going to see a completely different dentistry in terms of prosthesis material, materials, implant design, protocols and everything. I think that I know this is hard to for me. At my age, I'm not so old, you know, but I can tell you that it is important for me to remember the times in the 60s, 70s, 80s, where osseointegration came to the implant field, and that was a revolution. I think that digital dentistry is the same kind of revolution that osseointegration, in terms of future, in terms of things, how things are changed in that time and now are going to change. So I think that materials, protocols and everything is going to change and make a new dentistry.
We know that the complete reconstruction is the most difficult thing.
You mean the full arch?
The full arch, yes. And when the patient is coming to our office, they sometimes ask us which material should be the best for me, which is the safest, which maintaining will be the easiest one. Do you have the solution for this?
No, I'm afraid not. But again, it's a question of preference of each professional. No, I think that you know, even if the case you are talking about, no, every prosthesis, dentogingival prosthesis, nicely made with zirconia, IMAX, there are different approaches, no, and different solutions. So I have the solution. I'm afraid I don't have it. Only one thing, I think that the future is about monolithic materials, and in terms of speed up the treatment and solution, I think that monolithic materials with little things to do in the material are the future, most of the cases.
And you also mentioned speeding up
because you don't need to use a lot of devices to finish your work, you know. So I think that in the labs field, digital labs built or established with the digital field in mind I think that it will be successful for labs. So it means that you don't need a lot of things to finish a prosthesis. Even you can not need a model from. You are talking about, for example, monolithic zirconia in some patients. No?
Mm-hmm. We also know that all these tools, devices, for now are expensive. Yeah. So should this using of these tools should impact the prices at the clinic? What do you think?
No. For my personal experience, no. I can tell you that it is difficult to say, no. But if you, I think that you need to incorporate technology. It depends of the way you are practicing. Of course, most of the clinics now, or a lot of them, has CBCTs, for example, in their settings. And 10 years ago, it was only a few, you know. I think with digital, with the intraoral scanners, it will be the same. Now it's about 3%, 4%, it depends of the countries, of the markets, but I think it is going to be a blast, you know, because it's going to be incorporated for most of the clinics. Of course, it's going to be more accurate, more precise, more cheaper, but the sooner you are in this train, the best you are going to perform and to do it and to enjoy it, because this is something to be enjoyed in your practice, to perform excellent treatments with excellent quality, and that's in the bottom, to enjoy our work, our profession, you know, to do things different. That's a good, a nice. Nice feeling, you know. Okay,
so let's do thing different from Monday. Thank you one more time, Doctor.
Thank you. It's a pleasure. It's been a pleasure. Thank you so much.
Thank you so much, and have a nice time in Warsaw.
We'll enjoy a lot, of course. Thank you so much.